Introduction: Keir Starmer's proposed immigration shake-up could trigger the biggest exodus of nurses in British history, and the NHS may not survive the fallout. What looks like electoral realism in Westminster reads as a looming catastrophe in hospitals up and down the country. This episode unpacks the policy, the numbers, and the consequences for patient care and the health service millions rely on. The policy at the centre of this storm is simple to describe and devastating in effect. Labour is proposing to tighten settlement rules for foreign workers, doubling the current 5-year route to indefinite leave to remain (ILR) to as much as 10 years. That change is paired with plans to raise skill requirements to degree level, introduce tougher English language tests for all visa holders, including dependents, and overhaul how migrant workers settle in the UK. In Westminster, these moves are being sold as pragmatic electoral realism, a way to show toughness on migration as Reform UK and Nigel Farage push anti-immigration messaging. In NHS wards and staff rooms, they are being seen very differently. Nursing leaders call the proposals immoral and warn they treat internationally trained nurses as political pawns in a fight for votes. Their concern is not just ethical. It's about patient safety. The numbers make the threat impossible to ignore. Of Britain's 794,000 nursing staff, more than 200,000 were trained overseas, roughly 1 in 4. The Royal College of Nursing surveyed over 5,000 migrant nurses and found that 60% of those without ILR said the proposed rule changes would make them very likely to leave the UK. Translate that into real people and you reach about 46,000 nurses preparing to walk away. Government data shows another stark fact: 76,876 nurses have gained visas since 2021 and would be directly affected by any delay to settled status. RCN Chief Professor Nicola Ranger has been blunt about the stakes. These proposals are not just immoral. They would be dangerous for our patients. She urges Labour to abandon the plans, warning they would deepen the NHS workforce crisis, push thousands of highly skilled nurses out of the country, worsen already dangerous staffing levels and blow a hole in efforts to reduce record waiting times. Given Minister's own admission that domestic recruitment isn't keeping pace, forcing experienced staff out now would be reckless. This is a political calculation with human consequences. Labour's push to look tough on migration is clearly aimed at blunting Reform UK's appeal to voters anxious about housing, wages and public services. But a decade-long limbo for the workers propping up the NHS is not a policy tweak, it's a gamble with lives and with the future of a public service the party has vowed to fix. A party can chase votes and rhetoric about lower immigration, but it cannot run an NHS without nurses. If Labour presses ahead with this plan, it risks being remembered not as the government that saved the NHS, but as the one that drove a large part of it out of the country. Starmer may have wanted to look strong, but he risks looking short-sighted. And the cost will be measured in wards left short-staffed and patients left waiting. Closing: this isn't an abstract debate about statistics or immigration policy. It's a decision that will shape care, safety, and staff morale across the country. The question now is whether political strategy will give way to the practical realities of keeping the NHS staffed and safe before it's too late.